As of Friday, all of the key indicators for COVID-19 in Oklahoma are slightly improved this week. The rolling 7-day average for new cases has fallen by close to 300 per day. Hospitalizations are ticking down. They are still above 1,500. And 31 fewer people are occupying ICU beds. And while 204 people did die this week from COVID-related causes, that number is 14 less than last week. Just over 44% of Oklahomans are fully vaccinated. COVID patients trying to avoid the hospital in Oklahoma have been receiving monoclonal antibodies as a treatment therapy to lessen the severity of the virus. It's not a substitute for getting the vaccine, but it is saving lives. Jason Doyle reports on how the treatment works and on concerns that the new U variant might be resistant to treatment.
Monoclonal antibody therapies have been used for numerous other diseases like rheumatoid arthritis or certain types of cancer. 3 such therapies are now being used to treat people with mild to moderate COVID-19.
It's a very exciting therapy. It's been looked at in some other diseases, but it's never been deployed like some other new technologies on this grand of a scale.
Monoclonal antibodies are similar to a treatment which had an early promise, convalescent plasma.
The difference is it's a much more predictable dosage. When you do convalescent plasma, you don't really know how much antibody is in that unit of product that you're giving to the patient. And the data on convalescent plasma was spotty, and although it was all we had at the beginning, it has since fallen out of favor.
The key to making sure a monoclonal antibody treatment works for a person with COVID is early detection and action.
We want to use this early, especially in people that were the most worried that they could go on and develop severe COVID requiring hospitalization or need help with basically breathing machines.
These treatments also show promise even with new COVID variants like Delta and Mu.
These monoclonals were basically developed against earlier variants. However, that's one of the reasons to not just use one of the monoclonals, but to use them in combination. And so in combination, it looks like these are going to continue to be protective against the virus strains that we're seeing right now.
The treatment can be used by those who have been vaccinated or unvaccinated too. But if a person is hospitalized and has to use oxygen, it's too late. While the data indicate monoclonal antibodies have become an effective treatment for when someone first gets the virus, it seems public awareness of the treatment is low. Senator Rob Standridge is trying to change that.
I, of course, was familiar being a healthcare professional and all of that, and even maybe being an elected official makes me more aware, but I was more and more stunned as time went on of how many people don't know.
He started working with Cleveland County officials and others to launch an awareness campaign.
Talking to the governor's office as well, getting state help. So the health department has been immensely helpful so far. We're just now, it's an awareness and availability campaign is kind of what I'm calling it. So I think the awareness is the most important part.
Currently, the monoclonal antibody infusions have to take place in a hospital setting.
I want to involve more community health partners. The hospitals are the hub, if you will. The hospitals are the key element, that in the health department. So we got to work outside that hub.
Norman Regional Hospital is trying to do just that by setting up an outpatient COVID infusion center just outside its main hospital.
We offer the Regeneron monoclonal antibody. It is given by referral from healthcare providers.
Davis says patients should prepare to spend a couple hours at the infusion center.
It is an infusion that it goes into the IV. It takes about 30 minutes to infuse, and then we monitor them for about an hour after the infusion just to make sure there's not an immediate reaction to the medication.
From what she's seen so far, the treatment has kept people from going into the hospital.
The amount of patients that we have seen here, we've been able to keep most all of them out of the hospital, which helps my colleagues not be as overwhelmed with people that we can keep away from the hospital, and they can treat the ones that need to be there.
Full disclosure, Jennifer Davis is my sister. Last year, our mother passed away of COVID-19. While I couldn't be by her bedside, my sister was. And Jennifer says the new treatments available now give her hope that was hard to come by before.
To be able to watch tragedy happen with my own mom, and to be able to hold someone's hand here, to be able to give that infusion to help them so they don't end up like my mom, is a gift.
While the monoclonal antibody treatment is promising, it does not replace the vaccine.
monoclonal antibodies are not a replacement for vaccination, because vaccination, not only does the vaccination help you make antibodies, it also helps basically get the rest of your immune system ready to fight off the COVID infection if you're exposed.
As more data is collected, medical professionals believe the FDA will continue to widen the population who can receive the treatment. Jason Doyle, the Oklahoma News Report.